Hi, everyone. Welcome back to Every Month Med podcast. This month, October being Breast Cancer Awareness Month, we want to focus a little bit on this. To provide a little bit of insight, we want to provide a couple of facts about breast cancer to exhibit how prevalent it is. About 1 in 8 women in the US develop invasive breast cancer throughout their lifetime. As of January 2020, over 3.5 million women have had a history with breast cancer in the US.
Breast cancer in American women is the most commonly diagnosed cancer aside from skin cancer. In 2020, it was approximated that 30% of diagnosed cancer in women would be breast cancer. We also wanted to bring in an expert to discuss a little bit about breast cancer as well as breast cancer during the time of COVID-19. Dr. Ashish Shah specializes in various oncological fields, including breast cancer, lymphoma, digestive cancer, and liver cancer. Dr. Shah completed his Hematology and Oncology Fellowship, as well as his internal medicine residency at Robert Wood Johnson Rutgers University Hospital at the Cancer Institute of New Jersey in New Brunswick. Dr. Shah is board certified in hematology, internal medicine, and medical oncology. Currently, Dr. Shah works at the Advanced Care Oncology and Hematology Associates here in New Jersey. Without further ado, welcome Dr. Shah. Thank you so much for being here.
Thank you for having me. It's a pleasure talking to both of you.
All right, so can you just tell us a little bit about breast cancer and the work you are in regarding it?
Sure. So as you had stated with your statistics, breast cancer is a very prevalent cancer that we see in women and also in a few men per year. The advances have been really, truly amazing. I can just say that, in the 18 years since I was a medical student, the advances in just how we give chemotherapy have been tremendous. Just managing side effects such as nausea and vomiting, those were, in the old days, such a barrier to patients' quality of life and their overall, aspect of living. But we've made tremendous improvements in just how we actually administer chemotherapy. But really, I would say in breast cancer and really for all cancers in general at this point, the pendulum of treatment has really been shifting from chemotherapy to more what we call targeted therapy and immunotherapy. So these targeted and immunotherapies are now the transition point. We personalize and tailor the treatment for every individual breast cancer patient based on characteristics of their breast cancer. And it's not just having cancer in the breast. There's basically an entire array of molecular signatures, mutations, pathways that we can now measure with PCR and very detailed biotechnical analysis to then match up the type of breast cancer, especially the more aggressive variants, to targeted therapies and really hone in on what we call trigger point or the target mutation or signal driver would be that stimulates that very first cancer cell to then develop into the tumor. So I would say that because of the targeted therapy, the side effects of some of the newer therapies that we're using for breast cancer are much more manageable. In fact, a lot of them are oral therapies, so women can take their medication at work, at home. They don't have the stigma of even looking like a cancer patient per se, can maintain their normal life. In fact, stage 4 breast cancer is probably one of the biggest areas of development where, the average now median survival has gone over 10 years. And these are, women with stage 4, what we used to consider terminal breast cancer, who are living, beyond a decade. So I think that has been an advance in itself. But of course, there's been, tremendous gaps in being able to treat the more aggressive breast cancers, the ones that really, diminish survival. So constant research going on, but, just in my short career, I've seen tremendous advances. And I think that bodes well not only for breast cancer, but for cancer in general.
Yeah, I think it's really interesting to see how adaptable treatments are becoming, which kind of segues into our next question. How do you think Breast Cancer Awareness Month affects the mental state of your patients?
I think there's a lot of pride in recognizing cancer. Obviously, it being Breast Cancer Awareness Month, there's a lot of camaraderie amongst the patients. We have 5 different offices here in New Jersey, and we have these infusion centers where we give our patients chemotherapy. And there's a lot of bonding that goes on between different patients who are sort of sharing the similar experience of going through chemotherapy and treatment. But having awareness, I think, not only helps recognize the patients who are going through treatment, but also brings the uh, foresight of the disease to people who need screening. I think that's really the key point of these awareness months, is to get people to acknowledge and recognize the fact that breast cancer is not something that affects just old people or young people or people with family history. I mean, everybody at a certain age needs to be aware of the risk of certain cancers. And of course, with breast cancer, screening includes yearly mammogram starting at the age of 40 and earlier if you have a family history. So just basic screening that, again, we would really emphasize. And this is where, again, the survival curve has been most tremendous in terms of change and overall survival in beating cancer, is by detecting it early and being able to stop it and to treat it and cure it before it becomes advanced.
Definitely. So a follow-up question to the last one. Do you think that your patients with breast cancer feel more supported in October from society compared to other months?
I mean, I think there's activities, certainly we rally around using these months to get the community to um, provide fundraisers. We do walks and things of that nature. So I think, yeah, I mean, it definitely makes them feel a little bit more recognized. But I think just knowing how cancer patients um, interact and also how they deal with their disease, in some people's case, it can be a very private journey and a private battle. So I don't know how much um, making it a public sort of announcement changes some people's views, but in others, it can help them sort of, become more of an advocate, and also with support groups and things like that. So I think if somebody was in the shadows and needed some help with support, I think having these months as recognition can also bring about some community awareness as well.
Yeah, that's a perfect segue into our next question as well, which is, what do you think is the best way to support someone undergoing the treatment for breast cancer?
So, whenever I meet a new patient with breast cancer, it's always important to me to know their family situation. Do they have a spouse? Do they have a parent, a sibling? Who do they live with? Do they live alone? All of these things are very important, because it's not medically, medically I can come up with a regimen and a treatment plan and have everything, you know, listed from A to Z. But, a lot of things I encounter in the community is, transportation issues, or limitations on taking time off from work, or just having someone at home who can prepare meals. So, I mean, there are barriers that need to be addressed. And fortunately, we use resources such as the American Cancer Society, and we have a lot of resources through Atlantic Health that actually provide services to patients. And then we also have within our practice, a lot of resources financially for patients who can't pay for their certain copays, and some supportive medications to help them with things like nausea and diarrhea and weight loss and nutrition. So we do everything in our power to help them ease that transition, so they don't need to worry about all the other maybe extraneous aspects of their management of their treatment, and focus really on just fighting the cancer. So we do, I mean, everyone in my group has that same mentality about focusing on the patient and their support system.
I think that's really incredible to kind of look at the empathetic side of medicine. And
Yeah.
it's really cool to see how you and your colleagues are really prioritizing that, especially in the age that we're living in. So our next question is, how do you think recent advancements in technology have affected the way you approach breast cancer treatment?
So one of the biggest advances in breast cancer treatment, and really all cancer treatment, is having um, electronic medical review or records. So EMR um, allows us to really get information very quickly, not just about our patient, but about their previous treatment, where they were previously treated, um, if they were admitted to other previous hospitals. But the flow of information is so rapid now that in the consultation of a new patient, you can have access to their medical records, but also have access to whether they would be a candidate for clinical trial. You can electronically contact a lot of the larger cancer centers, see what other treatments are available nearby. But I think technology has also helped specifically for breast cancer. When I was in training, we used to write chemotherapy by hand on a piece of paper. calculate the doses, by hand, sometimes even without a calculator. So, it took a lot of time to just do the logistics of our treatment plan. And then, there were always the fear of making an error. But, I think what technology has helped us with is to streamline the treatment so it can be more efficient and obviously more safe. And I think there's lots of checks and balances now between pharmacy and the treatments that we're giving. And, we give combination chemotherapy for a lot of our advanced breast cancer. So it's important to be able to give it safely and not to worry about some of the details in terms of whether your calculations are correct and the dose is correct. You have so many backup programs, and certainly the computer technology has advanced that. And also just the access to what is out there in the data world in terms of published phase 1, phase 2, phase 3 new trials, new clinical agents that are coming on, almost on a daily basis. So being able to get those email blasts and certainly being able to do that quickly through a computer, whereas before we used to look up these regimens in a book or a journal, just has streamlined the access to information. So I think obviously for patient care, it has made it much easier to advance the field.
Yeah, I mean, technology has helped us so many ways during this pandemic, and it's great that it's helping you guys in breast cancer and fighting cancer. So our last question is, how do you think the recent events of COVID-19 pandemic have affected how you treat your cancer patients?
So that's a very good question. I mean, it's something we're sort of addressing and readdressing really each week, each month, because this is obviously a crisis that's not over and may very well continue or even get worse before it's over. So, our practice by March had to resort to switching to tele visits or virtual visits for at least 50%, if not almost 80% of our practice, depending on our office. We had to close 2 of our 5 offices, 3 of our 5 offices. So we were limited in our ability to reach out to patients. But, being able to do doctor visits virtually was obviously a new experience for all of us. And it wasn't easy. It was, difficult, but it was something that I think because our practice has a very good rapport with our patients, and some of us have been here for 4 years, 5 years, 10 years. So we have a lot of trust between both the patients and the physicians. So I think them being more engaged in the virtual visit, knowing that, this is a temporary way of keeping each of us updated on the medical condition at hand and seeing what we can do. But, we had to be creative. And, it was also an opportunity to use technology, of course, through Zoom and through other types of devices where we were able to not only engage the patients, but actually, still make a business of our practice and be able to, continue running this as a medical practice. But the other thing that, we've learned, and this is from the American Society of Clinical Oncology ASCO guidelines, is there were actual recommendations made during COVID for the administration of chemotherapy, because we really had to be careful to not give certain chemotherapy agents that would make someone very immunocompromised if we, because there is data now saying that a lot of the cancer patients who are immunocompromised, or what we call neutropenic with a low white blood cell count, were at much higher risk of not only getting COVID, but then having a worse outcome if they were to get the infection. So things that we did to mitigate that would be reversing the sequence of some of the chemotherapy that we normally give for breast cancer, giving the drugs that would be less likely to make them immunocompromised, give them up front for maybe 12 weeks, and then when the risk of COVID was sort of diminishing, then introduce the more stronger chemotherapy, or make a decision to just postpone certain treatments for 3 months and sort of just wait it out a little bit because of the risk being too high. So we used also something called growth factor a little bit more liberally. This is to increase the white blood cell count so the patients recover faster, their immune system and reconstitution. So again, giving them more of a chance to be prepared should they have an encounter with COVID-19. So we had to learn on the fly. These guidelines were made literally overnight. So, all of us in the oncology community, specifically with breast cancer, I actually had a patient who I did that reverse sequence of chemotherapy, and she's actually done very well and got through that chemotherapy. And then we've actually still postponed the more intense chemotherapy until a proper time, but she's had a very good response thus far. So there's just been a lot of creativity and thinking outside the box, which sometimes the innovation comes at its greatest pace when people are forced to think outside the box. So I think as a community, it's been a challenge, and as a physician, it's definitely been a challenge navigating treating oncology patients through COVID-19. But what I've seen is that there have been some patients who have been still reluctant to go to the doctor or to go to the hospital, and something like breast cancer, you really need to keep up with your screening and keep up with your surveillance, because certain things can be missed, and we don't want people's health to suffer just because they haven't seen a doctor in 6 months. So
Definitely. I think this pandemic has tested everybody and promoted and provoked a lot of innovation, especially it sounds like in the medical community. So those were all our questions. Thank you so much
Thank
for
you.
being here today, Dr. Shah.
I
We
appreciate it,
really
Meg and Ishan. Thank you for having me, and hopefully this was entertaining and educational for your fans as well.
It was very insightful.
It definitely was. We really appreciate you taking the time out of your busy schedule to provide us with some insight. Thank you everyone for listening in. And as always, if you have any suggestions, please leave them in the comment section below. Stay safe, everybody. Bye.